The first step in getting the AED in use is knowing where it is. Then you want to get it. You don't want to stop CPR unless you're by yourself. If you're by yourself, you're going to have to stop doing compressions. We always go to compressions first. We're not really checking for pulses anymore. If you're having two people, somebody knows how to do compressions adequately, we want to continue to do compressions while the second person is coming in to put the AED on. But if you're by yourself, you want to call 911 first. Recognize somebody's in cardiac arrest. We do still look and listen, but we don't necessarily feel for a pulse anymore. Sometimes it's just as simple as opening up an airway, somebody would actually start breathing again. So if that isn't the case, we want to get right on the chest. We're not going to do breaths first. There is layperson CPR now, so you don't have to do the breaths anymore. It's all just hands-only CPR, they call it. And you would find your location where you would want to start doing your CPR. So there's several different ways you can do it, but basically center of the chest. You want to get them on a nice hard, flat surface. And start compressions. And we're going to do 100 to 120 compressions a minute. Once we do our CPR, we're by ourselves, we can now put the AED on. So we gathered our AED, we have it here, the case comes off, and the pads have little pictures on them, right? Tells you exactly where to put them. Now this particular AED is attached, it also has a centerpiece where you put that right in the center of the chest. Some AEDs don't have this piece here, but it'll still have pictures. Every set of pads, whether it's adult or child, has pictures on the pads. Pretty simple. So we want to put those pictures right where it says onto the chest. So we can peel it off. This is in the upper right-hand corner of the chest, just like that. This goes right, should land about center of the chest. Then we want to peel this one off. Nope. Peel that one off. And it'll go in the lower left, lower left of the torso. And then we would turn it on. Now some AEDs want you to put the pads on first. It doesn't really make a difference, or it'll tell you what to do. And it'll go through its cycle. It'll tell you what to do, hopefully.
Unit, okay. Stay calm. Check responsiveness.
So even if you get a little distracted, the unit itself will tell you. While it's going through its scenario of what to do, you can also put your phone on 911 and put it on speaker. And that EMT dispatcher will also tell you what to do and ground you to tell you what to do. They're all trained in Delaware County. So we have already attached the defibrillator pads. That's what these are called.
Attach defib pads to patient's bare chest.
And it'll tell you if they're not on right.
Attach defib pads to patient's bare chest. Don't touch patient.
Okay, so now it's got to analyze what the patient is doing, whether they have a heart rhythm or not. The AED will only shock two kinds of rhythms. So you can't put this on a regular person, it'll say no shock advised. Or if they have no rhythm whatsoever. So now it's going to tell you to shock. I'm clear, you're clear, we're all clear. You want to make sure nobody's touching the body or the patient.
Shock delivered. Start CPR.
And it's going to say shock delivered. We're going to start CPR again. And every time that beeps, that beeping noise is called a metronome. That beeping noise is going to give you the rhythm that you're going to perform for your compressions. So basically, you would continue to do what the monitor said, unless several things could happen. You could become completely exhausted. Help arrives, which should be hopefully a paramedic, but sometimes you'll see a police officer first, or even a fire department first will come and be on location before the ambulance even gets there. Or the patient becomes more conscious, where they start breathing again.